I think that if we were to start with the whole issue about therapy, one of the first things that we would think about is pre-therapy. So that's before therapy. Because of the nature of the lives that refugees and asylum seekers face when they are in this country or any other country, the issues about trauma, that's the trauma that they faced from where they come from, the issues about displacement, the issues about bereavement, because some of them have faced multiple losses on many levels, death, loss of homes, loss of work, issues about identity, loss of who they are in terms of their status and what they did. There are also issues about mental health, particularly dual diagnosis. So you might find things like depression, anxiety, post-traumatic stress disorder, generalized anxiety, and the list goes on. There is also issues about just the basics that we face on a day-to-day. So we're talking about what we say is the Maslow hierarchy of needs arena, which is the food, shelter, places to live, work, issues about esteem, issues about belonging, which fundamentally are non-existent in a lot of cases. So these are some of the issues that, before the therapy even begins, that people face. The first thing is, if I compare some of my other work that I do within the NHS and other settings, and the work that I do with Solace with refugees and asylum seekers, more often I find when we're working with refugees and asylum seekers, you hear things that really shock you. So, for example, somebody said to me, I was asked to kill my father, asked to kill my mother, or issues of rape, etc. And I'm not saying these issues don't happen in this country, for example, but often what we're dealing with is sort of the extremes, torture, trauma. So the first thing that happens is these shocking things that you hear that other humans have experienced can cause a destabilization. So it's essential that the therapist who's coming to this arena has solid supervision and knows how to self-care when they're dealing with these issues. That's the first thing. The next thing is, if you've never worked with translators before, you have to learn to speak slowly so that each word you understand what's being said, or what you're saying is being translated in exactly the way that you would like it to be said. The other thing is obviously the technicalities of language. So in some languages, we might not have certain words that we have in English. For example, the word depression. How do you translate that in different languages? So these are complex matters that the therapist needs to be fully aware of. And then how do you manage having issues of confidentiality in the room? Often some languages you're working with a translator that comes from exactly the same community as the individual you're working with. How do you manage issues of confidentiality, etc.? So complex issues. If you had a client that came, say at Solace, and they said, well, I was hearing voices last night, or I had a visitation last night. Traditionally, what I found in mental health, we would automatically start thinking, psychosis, hallucination. But actually, if we consider transcultural issues, we must then consider the individual's culture. Then I might explore with the client, well, what does this mean for you? In your culture, what would happen? And you might find that in their culture, visitations in the night are quite common. So when we're working from a transcultural perspective, we have to take into consideration the individual's culture. And sometimes this clashes with our therapeutic modality. If a client is late, what does this mean? Are they resistant to therapy? Or is it culturally, for them, time for meeting with another individual is precious time, and it can start at any time and end at any time? If I say to a client, we're coming up to the hour now, how will the client feel about that? And yet, so the challenge is, how do you maintain your therapeutic modality but also fully meet the client from their own cultural perspective? And that's what transcultural working is about, whatever modality we're from.